Hello and congratulations, you found a practice to buy. It's not easy to do these days, so congratulations. It's a first big step in your career towards financial independence because as you've probably seen, working for someone else as an associate has its benefits. You gain a lot of experience, but one thing you don't do is you don't build a lot of wealth. So the beauty of practice ownership, as hard as it is to be an entrepreneur, is you're going to be able to build some wealth. So how do we get you off on the right foot? Well, it's very easy for me because this is all I do for dentists, but here are a couple things to keep in mind. The first thing is you need to do what's called due diligence. Now, this is a fancy word for doing your homework on the practice, and there are three kinds of due diligences that you need to do. The first is financial due diligence. So financial due diligence is you get your CPA, you get a bank to look at the numbers of the practice, the tax returns, the profit and loss, all of those things, the balance sheet, you have them look at all that. If you need a good CPA, I know a couple. Now, that's the first due diligence. The second due diligence is the legal due diligence. That's my part, of course. So we look at your contract, we look at your leases, we look from an HR perspective, if there's any liability there, set up your corporations and just get you off on the right foot legally. The third due diligence is the one that a lot of people don't do, but it's the one that I think is probably one of the most valuable, which is to have a consultant who is a practice transition specialist. Now, not all consultants fit this, okay? There are a lot of consultants that will charge you, 1-2 year contracts with all this kind of crazy stuff. No, you need a practice transition consultant that will work with you on this transition. That's their specialty. Again, we have a couple really good people that we can refer you to, and they will look at the practice data, right? They will look at how many new patients are coming through the door, how many patients are not staying with you, that are leaving, are they accepting treatment? Do you need to bring in technology and other things to increase patient, acceptance? These are really vital because as I've seen example after example after example, knowing if the seller is accepting co-pays or not, knowing if patients are staying, for treatment, are they just coming in for hygiene, do they pre-appoint hygiene? These are all vital pieces of information that you need to know as a buyer. The third thing is really, I think, the riskiest part of all of this whenever you're buying a practice, which is the HR risk. And so you need to make sure that you are HR compliant from day one. Don't wait for a month, 2 months, 6 months, a year, 2 years. No. You got to get HR, you got to get payroll, and you got to get 401k set up for all of your team members. Now, you don't necessarily have to contribute to their 401k. There's a lot of different strategies about that depending on your budget and what you can afford. But you got to set these things up so that you have no liability when it comes to your employees. A lot of information there. You're not going to be a dental law expert, but this is the right, step to take as you're getting ready to purchase a practice. Reach out to us with any questions. Thanks.